Hello, I'm Tim Adlam, and I'm leading Work Package 7 in PRIME-VR2. I'd like to talk to you about the goals of this work package and something about the people that are working in it. We're facilitating the link between people that will be using the PRIME-VR2 technology and the designers of the technology. We're finding out what people with stroke, musculoskeletal injury and dystonia need in a virtual reality rehabilitation system, and how it should be designed to be engaging and usable by them and the clinicians that look after them. We have 3 clinical teams working on this project. Milos Stanislevich, Director of Planet Health and a physiotherapist at the St. James Hospital in Malta, is working with people with musculoskeletal injury. Onisiferos Hagionissophorou is Managing Director and a physiotherapist at Kinesifero and NicoMed in Cyprus, working with people with stroke and other disabilities. And Dr. Hortensia Gimono is working with young people with dystonia at the Evelina London Children's Hospital, where she's the lead occupational therapist in the Complex Motor Disorders Service. They are supported by Professor Anthony Steed and his virtual reality research team at UCL, and me, Dr. Tim Adlam, Associate Professor at the UCL Global Disability Innovation Hub and the lead for Work Package 7. We are supporting the design teams in their work on the controllers, the software, the virtual reality environments and systems, and working with our patients, gathering their views, opinions and experience to ground the project in patient and clinician reality. We're bringing our expertise in engineering, design and virtual reality systems to support this project. And we are meeting the challenge of COVID-19, adapting our work, finding new online methods of engagement and continuing our research to bring patient reality to virtual reality in PRIME-VR2.